My name is Dr. Michael Holick, and I'm professor of medicine, physiology, and biophysics at Boston University Medical Center. We recently reported in PLOS1 in the past week on 191,000 COVID positive patients in collaboration with Quest Diagnostics. And what we observed was that if you're vitamin D deficient, you have a 54% chance of having a higher risk of acquiring this infection compared to patients who are vitamin D sufficient. And the higher your circulating level of 25-hydroxy vitamin D, up to 55 nanograms per ml, continued to give you a benefit. So the higher your blood level, up to 25-hydroxy vitamin D, up to 55 nanograms per ml, reduced risk of acquiring this infection. And this included African Americans, Hispanics, whites, Asians of all ages in all 50 states in the United States. We also found that African Americans and Hispanics are more prone to vitamin D deficiency and at higher risk, therefore, of acquiring the infection. So the next question, of course, is that if you have the infection and you're vitamin D deficient, is it having any consequence on the outcome? And working with Dr. Magabuli from the Neuroscience Institute from the University of Tehran Medical Sciences and her colleagues, and Dr. Arash Shiravani as a member of my group, we looked at 235 patients that presented with COVID-19 infection. More than 70%, 74% had severe infection. And we asked the question that if you're vitamin D deficient, are you more likely to be hypoxic and unconscious, have more serious consequences, and does it increase risk of death? And we observed that if you have a 25-hydroxy vitamin D level of above 30 nanograms per ml, there were less hypoxia and less patients becoming unconscious. We also looked at CRP levels, which is a measure of inflammatory activity. Significant decrease in CRP levels. There was an increase in lymphocyte count, all suggesting that improvement in your vitamin D status will improve your immune system and help you fight this infection. We also looked at mortality, and we found that we didn't find any mortality under the age of 40, which is consistent with many observations. If you're vitamin D sufficient, we found only about 6.9% were having mortality compared to 20% who were vitamin D deficient. So the take-home message is that vitamin D plays an important role on modulating your immune system. It helps you to fight the infection, and it modulates your immune system to prevent the cytokine storm that is a major contributing factor for the morbidity and mortality associated with this infection. And therefore, improving your vitamin D status makes good sense. What should you do? The Endocrine Society Practice Guideline recommends infants 400 to 1,000 units a day, children 600 to 1,000 units a day, and I believe teenagers should be treated like adults, 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more vitamin D. You don't need to get a blood level of vitamin D because these amounts of vitamin D will not make you toxic unless you have some sensitivity to vitamin D that you and your doctor know, and then you should discuss it with your doctor. But otherwise, you don't need to be tested. These amounts of vitamin D will improve your vitamin D status into a vitamin D sufficient range, reducing risk of acquiring the infection and reducing the complications and death associated with it. Thank you.